Imagine an injury so severe that it alters your personality or even sends you into a state of depression. Well, these symptoms and much more severe things can happen if you are involved in a concussion. A concussion can sometimes be hard to identify, so it's always important that if you do think you have sustained a concussion, that you see a doctor as soon as possible so they can properly diagnose you. Concussions are most popularly found in people that play high-contact sports such as hockey, football, and boxing. So what exactly is a concussion and how do we identify it? A concussion is damage to the nerve cells of the brain. Your brain is cushioned by cerebrospinal fluid within your skull. But when you take a hard hit to the head, your brain can be jolted back and forth and bounce off your skull, causing damage. The worst part about a concussion is that many people do not even realize they have sustained a concussion when they do have one. Many people think a concussion is a hard hit to the head followed by unconsciousness. Although unconsciousness is a symptom you may experience, it is not the only symptom you may experience, and it does not always occur. You may also experience short-term symptoms such as headaches, dizziness, slurred speech, confusion, nausea, and vomiting. There are also long-term symptoms that may start within hours after the initial blow to the head. These include memory loss, irritability, sensitivity to light and sound, sleeping problems, and depression. A concussion can also become life-threatening in many different ways. Two ways it may be life-threatening is if you have a torn blood vessel in your brain, which can cause you to bleed out, or if you have brain swelling from being unconscious for too long after the initial hit to the head. The proper thing to do to recover from a concussion is to give it time to heal. Giving it time to heal includes plenty of rest and limiting your focused activities such as reading and watching TV. If you do not allow your brain proper time to heal, you can suffer from many different traumas, including second impact syndrome. Second impact syndrome is when you suffer a concussion and before it has time to heal, you suffer another concussion. This can speed up any life-threatening problems such as swelling or a torn blood vessel. It is very important that you see a doctor as soon as possible after you take a hard hit to the head, preferably within 2 days of the injury. A doctor can do neurological testing, which is simply checking your balance, coordination, and your memory. They may also go as extensively to check with a CT scan. A CT scan takes X-ray images of your brain and then turns it into a two-dimensional view of the brain. This can help them identify torn blood vessels and swelling. A doctor can have you do simple observations at home or in a hospital for 24 to 48 hours after a concussion. There is no prescribed medications for a concussion, but you may take acetaminophen to help with any pain or headaches you may experience from a concussion. You never want to take ibuprofen. Ibuprofen thins the blood, and if you have a torn blood vessel, it can actually increase the rate at which it becomes life-threatening. Many people that suffer from concussions are those that are participating in high-contact sports such as hockey and football. Many trainers and these players are taking great protocol and many guidelines if they suffer a concussion, even not allowing the player to come back to play for months until they are fully done with any symptoms of a concussion. The NHL has introduced quiet rooms this season. A quiet room is used when a person has a hard hit to the head on the ice. They are then taken to this room to have time to relax and meditate while they're evaluated by a physician. This is a major improvement from what they've done before, where they were simply diagnosed by a trainer on the sidelines, where it's easily distracting. IMPACT, which stands for Immediate Post-Concussion Assessment and Cognitive Testing, is a system that has also been introduced to many different sports at many different levels. IMPACT is simply taking a neurological test of an athlete at the beginning of a season. This way, if they suffer a concussion later down the road, they can perform another neurological test and compare the results to see if they show concussion symptoms. Long-term symptoms of concussions are not very well understood, and so are diseases that may be caused by a concussion. past of famous players have been diagnosed or have been donated to Boston University's Medical Center in hopes of better understanding these long-term symptoms. In the recent years, many NHL and NFL players have agreed to donate their brains after they have had a concussion. All in all, a concussion is never to be taken lightly. There are many short and long-term effects that are associated with a concussion, but these are very hard to identify. So the most important thing you can do if you think you may have had a concussion is to see your doctor, who can properly diagnose and help you recover.